Welcome to this joint hearing of the Subcommittee on Economic Growth, Energy Policy, Regulatory Affairs, and the Subcommittee on Healthcare and Financial Services. Today, we are here to explore how innovative technology in the healthcare sector can help lower Americans' healthcare costs. Healthcare costs in the United States have long been on the rise, but recent Democrat policies and the radical Biden administration's regulatory agenda have made healthcare costs in America even worse. The Inflation Reduction Act, or the IRA, signed into law by the Biden administration in 2022, was passed under the guise of lowering healthcare costs for working Americans. These two subcommittees recently held a joint hearing on the ballooning costs and the market-distorting policies included in the IRA. Today, we have another opportunity to take a hard look at the consequences of policies that not only failed to accomplish their intended goals, but place an undue regulatory burden on Americans. Business owners in our country put their livelihoods on the line to develop breakthrough technologies to reinvent the healthcare industry, but are forced constantly to navigate the regulatory obstacles put in place by Democrat administrations. The money spent on legal fees and administrative procedures could be reinvested into further improvement to further improve technologies that doctors and other medical providers can use to improve patient experiences. They can be used to save lives and to bring families together. Congress must give private sector innovators the space and the resources that they need to develop these technologies. We've already begun to see the tremendous capabilities of artificial intelligence to help lower costs in our everyday lives. If that power were harnessed in the healthcare sector, resources could be more effectively deployed to help patients get better. In addition, lower costs would save the federal government and the taxpayers a lot of money in any of our federal healthcare programs. For example, patients can use wearable technology to monitor their health. These devices assist doctors and researchers with realistic data on their patients' day-to-day in real time. 3D printing can create personalized medical devices for individual patients. Investment in this printing technology has led to the development of customized prosthetics, implants, and surgical tools. Telehealth improves the efficiency of healthcare by allowing medical providers to serve patients in a live virtual call. Telehealth saves time and helps patients connect to their doctors, especially in rural areas where there are few medical facilities. These kinds of technologies are revolutionary. But if innovators cannot afford to develop more of them because of the expensive barriers put in place by the previous administration and the Inflation Reduction Act, the American people will miss out on cutting-edge medical care that could improve patient outcomes. Earlier this year, President Trump signed the One Big Beautiful Bill into law. That bill gives over $50 billion to rural hospitals to ensure that their continued operation and development of medical technology. Since entering office, President Trump has taken decisive action aimed at reversing innovation stifling, Biden-era policies in artificial intelligence, promoting transparent drug pricing, and eliminating the Biden pill penalty. Our expert panel of witnesses, including a fellow Missourian and a medical technology business owner, will provide testimony on this important issue. And I thank all of the witnesses for being here today, and I look forward to our discussion.